So KwaZulu-Natal has faced challenges and triumphs in the fight against HIV and AIDS. Once known as the epicenter of the epidemic, the province is transformed into a global leader in innovation and community-driven solutions. But the battle to end HIV is far from over this World AIDS Day. Newzroom Afrika's Nobuhle Modise reports.
KwaZulu-Natal has one of the highest HIV infection rates in South Africa. Yet, it's also home to groundbreaking medical advances and tireless community programs. Behind the statistics are stories of resilience, innovation, and hope. At the heart of the province's progress are its healthcare workers. In clinics, teams provide antiretroviral therapy, counseling, and testing services to thousands each month.
The HIV treatment protocols have evolved quite a lot since even when I was in medical school. The protocol for getting ARVs was quite difficult back then because there wasn't any ARVs that were easily available for South Africans. So by the time I started working, it was only then that people had easier access to ARVs that they needed. And back then, the protocol has actually changed quite a bit because initially you needed to have a very low CD4 count or you needed to be pregnant in order to get medication, to be eligible for medication. It was only later on in the years, around 2014, where everyone who tests positive can get ARV treatment regardless of their CD4 count.
For some, however, accessing quality health care remains a challenge.
Many people having started on treatment and then stopped. Why? Because our HIV response is being undermined by the dysfunctioning in our health system. Our clinics are in crisis. We leave home early hours in the morning only to wait all day not to be seen. Our files take hours to find or go missing completely. For those who are late for their appointments date, when we return to the clinic, we are shouted at and sent to the back of the queue to wait all day as punishment. Often staff are openly hostile to people from the LGBTIQA community, people who use drugs and sex workers. And if you don't have an ID when you go to collect your treatment, or you don't have a transfer letter when you go to the clinic, or to another, or if you are a member of the key population, you might be refused ARVs or sent away. There are simply solutions to improve this situation. One is for people who are collecting ARVs to get a longer supply of medicines. A longer supply of ARVs will mean fewer trips back to the clinic. It will make it easier to stay on treatment by reducing the cost of getting to the clinic and the hours spent waiting there 4 to 6 times every year. Importantly, it will also reduce congestion and overall waiting times for everyone using the clinic and reduce the burden on already overstretched healthcare workers.
Despite these efforts, challenges persist.
The World Health Organization said that all people living with HIV and who are stable on treatment must be given 6 months supply of medicines. And we have seen in other African states they have started implementing this. The reason for this is because it's all around the adherence of people living with HIV who are on treatment, reducing the number of visits that people make to the health facilities, but also reducing the congestion in our clinics. And when people are given 6 months supply of medication, this is what is in the new antiretroviral clinical guidelines issued by the National Department of Health. So today, we are marching to the Deputy President, Paul Mashatile, as the chairperson of the South African National AIDS Council, and Dr. Aaron Motsoaledi as the Minister of Health, to ask them to use powers vested in them to put pressure in provinces, districts, and facilities so that these facilities can start giving people living with HIV and who are stable on treatment 6 months supply of their medication.
Progress continues through innovations like lenacapavir, a revolutionary capsid inhibitor.
This drug is a capsid inhibitor. When I say that, I mean that this drug interferes with the shell of the HIV virus and therefore prevents multiplication of the virus. In this trial that we had conducted, a Purpose 1 trial across several sites in South Africa, none of the women that received lenacapavir became HIV infected, which is truly remarkable. So this is something that we should really be looking into, especially for those individuals that have a problem and face challenges with a daily oral medication, as this is an injectable that is given twice yearly.
Alongside medical breakthroughs, programs like community-led monitoring aim to address issues of accessibility and service quality for marginalized groups.
So that intervention is aimed at documenting some of the issues that are experienced by our key and vulnerable populations relating to how they are accessing public health services. So they are using that platform as a way of, documenting some of their challenges with regards to accessing services at healthcare, community healthcare centers. And then those results are then used to inform some advocacy interventions based on the data that would have been collected and analyzed. So once that information is available, then the community themselves, they table those advocacy issues back to the same service providers within the healthcare center to say that these are what the voices of the key and vulnerable populations are saying.
KZN remains a focal point in South Africa's HIV/AIDS fight. Advances in antiretroviral therapy and community-based education have improved lives, but more work is needed to combat stigma, ensure adherence, and address barriers like poverty.
For 6 months, if you take your antiretrovirals daily and be adherent to your antiretrovirals, you can actually find that your viral load becomes undetectable after 6 months. And if a patient realizes that, hey, I have an undetectable viral load, which means I'm close to being normal as possible, that in itself will give them the positivity to ensure that they want to live and they take their medication every day. They can live a happy, healthy, normal life. Other challenges are the stigmatization of HIV. And especially in our society that's very cultural orientated, we tend to see those with HIV as abnormal, and in some cultures they will bring bad luck to you. So the community, a lot of the community members who are not educated about HIV do not understand this. So they stigmatize the patients. And they obviously become depressed and lose hope in life and lose faith in themselves, and they decide, why do I need to take these drugs? In terms of access to healthcare, our patients can barely afford to take the transport to go and buy their groceries, to buy simple things like milk and bread. Now they are being forced to go to clinics that are way out from them to go and get their medication. So this little bit of money that they now have to use for their taxi fare, they cannot make ends meet.
On this World AIDS Day, KwaZulu-Natal's journey is a reminder of both the challenges and triumphs in the global fight against HIV/AIDS. The call to action is clear. Progress must not slow, and no one must be left behind. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise.